Welcome again to another session at ICFJ's Global Health Crisis Reporting Forum. For those who don't know me, I'm Stella Roque, ICFJ's Director of Community Engagement based in Washington, D.C. I'm delighted to welcome data journalist Davide Mancino, joining us all the way from Turin, Italy. Davide is a contributor to news outlets such as Il Corriere della Sera and Il Sole 24 Ore Infodata, where he's part of a team covering the COVID-19 pandemic from a data journalism standpoint. He has also contributed to news outlets in other countries, such as 538, Quartz in the US, El Confidencial in Spain, Correctiv in Germany, while working at the same time as a consultant and trainer in data visualizations. Before we begin, a few points. If you're a journalist on Facebook but haven't joined our forum group yet, please do. Search ICFJ Global Health Crisis Reporting Forum and apply to join the group. If you're not on Facebook, we have a mailing list where you can sign up to receive updates on upcoming webinars. Go to www.icfj.org and scroll down and click on the Covering COVID-19 Pandemic page. Next week, we'll have Dr. Linda Stewart from the Bill and Melinda Gates Foundation joining us to discuss COVID-19 vaccine development. Details and registration links are upcoming, so be on the lookout for that. Also, after every webinar, we send out a survey to our participants. Please send it back to us. Your feedback matters to us at ICFJ, so we can bring you the webinars you need. Please feel free to type in your questions for Davide during the session into the Zoom chat, which you can open by clicking the chat option at the bottom of your screens. If you're watching from Facebook Live, type them in the comments below the video and we'll make sure they get on the Zoom chat. And now for the main session, I'm turning the show over to Davide. Thank you so much for joining us.
Okay, so firstly, I want to thank Stella and the ICFJ for having me. And of course, welcome to everybody who is joining us today. So let me share my screen so I can start the presentation I have right away. There you go. So COVID-19 is basically a story of uncertainty. The data we have on this epidemic is very different from what we were used to work on in many cases. And to show why, I want to start with this. This is the Wikipedia page of the COVID-19 epidemic. And the basic takeaway here is that as of 6 months ago, this virus basically didn't exist on the planet. So there are huge limits to what we can know. This is very true for data. Why? Because there are two ways we usually get our data. First one is by counting basically everybody in a country and contacting them and asking them often door to door about their information, what they think, their age, and every kind of thing we can think of. This is what happens, for example, in the census in the United States and in other countries. Another way we do gather information usually is by counting only some people. This happens maybe in the most known case in political polls, where people are contacted by phone or by other means and asked what they think about any number of issues. Those are both two main ways by which we usually gather data. The first has the advantage of being pretty accurate and detailed, but it is also extremely expensive. That's the reason censuses are not conducted every year, or for the matters every 2 or 5 years. In most countries, they are conducted every 10 years, for example. And the reason is, of course, because they are very, very expensive. We can't do that much. Political polls or other kind of polls have the advantage of being much faster and very cheaper, at least compared to a census. At the same time, we can just phone or ask random people about their opinions, because that wouldn't work, because that's not a representative sample of the population as a whole. So you have to carefully select who you're going to talk to. However, with COVID-19, none of this is happening. We don't have the luxury of having the possibility of talking to everybody or even a selected sample of people. Why? Because in an ideal world, we will test anybody to see who's infected. But we can't do that because in no country there's an infrastructure in place to do that, or at least there's not yet. But even if we could test everybody, one-time tests will not be enough because people can always be infected later. And on top of that, they will need to get tested several times over until a vaccine or a cure is found. And furthermore, even tests are never 100% accurate. So you would have, even in the best case scenario, you would end up with a part of the population who is infected, and there's no way to know that. At the same time, each country is testing as many people as they can, but in most cases, then that's not enough, and that's very little to the extent of the outbreak. Also, data we have is being gathered in an emergency situation. This is a very important factor to remember, because in this case, there's no planning most of the time, and different methodologies of getting data are being used all around the world. We still don't have a clear idea if the information we have is representative of the epidemic as a whole, and in all likelihood, it is not. Also, healthcare system in some countries, in the badly hit countries like Italy, for example, have been overrun by the outbreak, and they could not keep track of everybody, even if they wanted to. So this means that we have numbers, of course, because we see them reported every day. We report them by ourselves, but this doesn't mean that every number is good or every number has to be reported as it is. Before starting reporting numbers, before start putting number in charts and maps and whatever in interactives, we have to understand what numbers can and what numbers can tell us. So let's start by here. Let's start here by maybe one of the most reported figures we see around, the number of confirmed cases. The first thing we have to note is the word confirmed. We don't know the number of cases, of actual cases, in any country in the world. Nobody knows that, and there's no way actually to know how many people are infected right now. What we can know, what we can do is run tests on some people and say, okay, we ran X tests and we found Y people are infected. Move this out of the way. Okay. So those numbers tells us how many people have been found with COVID-19. Well, we don't know actually how many have it, and they either are not sick enough to get tested or have no symptoms at all. Second example is about the number of tests. So how big can the difference can be between the number of tests and the number of cases? Actually, can be huge, and it often is. So, for example, this chart is about 2 regions in Italy. On this axis, we see the number of deaths in the region on the x-axis, and on the y, the number of tests run in each of the 2 regions. So this is Lombardy, the worst hit region in Italy, and this is Veneto. Both had roughly the same number of tests, but Lombardy had about 20 times more deaths. So this means that from other reporting, we can deduce that Veneto has a much better understanding of the size of the outbreak in the region. While in Lombardy, there's a huge undercounting of cases. So in this case, and in many others, I'm sure even in states in the United States, that's the same. And so in this case, simply reporting the number of cases will give readers no idea of this fundamental difference. Something similar happens when we are comparing countries when it comes to tests. So each country has a different testing capacity. And on top of that, their numbers are not always measuring the same thing. Nobody put in place a common methodology for countries all over the world. be them developed or in development. So as we see from this chart, every country, of course, puts out the numbers about their testing, but basically each of them means something different. So comparing them may not always be accurate. Here we get to the real number of cases. As I mentioned, there's no actual way to know how many people are infected. So what some epidemiologists try to do is infer the real number from the tested numbers, from the number of confirmed cases. And from this study, for example, made by a group of epidemiologists in the UK, we can infer that, for example, in Italy, that Italy was able to test only roughly 5% of all real COVID-19 symptomatic cases. And this means, of course, there might be millions of people that have it and nobody knows about. This is not true only in Italy. Something similar is happening in many other countries and in the US too. For example, in the US, they estimated that roughly 12% of the cases were found with tests. But this means, of course, that even in the US, there are, as of now, millions, and maybe tens of millions of cases we can't see. The next example is about the number of people admitted into intensive care units. So this is another measure we might use in the early phases of an epidemic. This is not as, how to put it, it tends to be a more precise measure than the simple number of cases. Because to enter an ICU, people have to be in pretty bad shape, actually. So the risk of undercounting is lower. At the same time, we can take this measure as we can take it for granted. We can't know if it always works. Why? This is an example from a story we ran early in the epidemic, when we wrote about a number of hypothetical scenarios to see under which condition the healthcare system could no longer keep up with the growing number of cases. That's what happened in Lombardy, the worst hit region in Italy, a region in which the peak of cases and the peak of people that had to be admitted into ICUs reached the peak capacity of the hospitals in the region. So by reporting the number we were reporting stopped to make sense because it could no longer go up because there were no longer ICU beds available. This happens because an uncontrolled COVID-19 outbreak spread so fast that it doesn't take long before the sheer number of patients to treat overwhelms hospitals. ICUs are very expensive and generally not set up to accommodate that many people because that's not the necessity in most of the cases, in normal times, should we say. Hospitals can expand their ICU capacity, but only to a certain point. And this gives us an upper bound on this measure. Even if the number of cases keeps growing, the number of ICU beds cannot go up indefinitely. Another important example is about the number of deaths. So you surely have seen this chart. The number of deaths is probably the most stable indicator to determine whether the outbreak is growing and at what pace. This is most likely the reason it's often the first measure is reported at major news outlets by data journalists at the Financial Times, the New York Times, and so on. The reason for this is that it's very unlikely, or should I say it's less likely that that goes unreported. Yet, we can say that the number of deaths is absolutely accurate. There are limits to this measure as well. And this chart shows why. It shows deaths and flu season. And here in the right part, the effect of COVID-19 is clearly visible and suggests that deaths caused by the virus are being actually undercounted. This is because the actual number of deaths recorded is much lower than this threshold reached here by this red line. But in this case, counting all causes of deaths, and so all deaths in a country, shows us that even that in most cases, COVID deaths by themselves are undercounted. And there are deaths that are happening outside of our knowledge. We see this even more clearly in this chart that maps the increase of deaths in roughly 1,000 cities in Italy. So, as I was saying, this is other data showing the same effect. How many people died in the first 3 weeks of March, both in 2019 and in 2020? In some cities, as we see here on the right, deaths grew by over 1,000%, which is much higher than the number reported officially by authorities. And this is again because testing capacity is limited, and during emergencies, not even all people that died got tested for COVID-19. And we see this in Italy, we see this in France, we see this basically in all countries, even if some of them are trying to compensate, for example, counting the number of people that died in hospices and similar situation. But still, there is always an undercount in deaths. So what are the lessons from this? What can we all learn? The main takeaway is, unfortunately, all data we have sucks, but some suck a little less. So the important thing to remember is that what we are reporting tend to have not nearly the same quality as something out of statistics organization like the OECD. That data we have is gathered in a real time and in a situation of crisis, with all kinds of different criteria and methods all around the world. There is no international standard, and every country is basically doing its own thing. This can also be true for different regional states in federal countries such as the United States in the same nation. So we also have to keep that in mind. Nonetheless, people have to be informed. So we have to work with what we got, to the best of our abilities, of course. Another important thing when we are reporting data about COVID-19 is that it's an outbreak that is evolving very quickly, and often in a matter of days. So a different phase of the epidemic requires us to look at different data. So let's go back to this chart. This chart again shows the number of deaths. As you might remember, Financial Times was one of the first outlets that started doing a chart like this at the very beginning of the epidemic. Why? Because it shows us the path of each country. And it's particularly useful, as I was saying, when the epidemic started, like maybe 2-3 weeks ago, 1 month ago, or something like that. So a chart like this is great for showing how quickly the outbreak is building up, as we can see here from the path, the patterns of the states, of the countries. But since the data we are seeing here is cumulative, it can't actually get back down ever. So a chart like this can show clearly when the outbreak starts reversing its course. So again, this is a chart, and this is kind of data reporting that's useful in the first phase of an epidemic. However, when we get to the next phase of the epidemic, when everything starts hopefully tapering down, we had to use other measures like again they did the Financial Times in this chart here. They started counting daily deaths, so not more cumulative deaths. With this other kind of measure, we can see clearly, again, the path that countries are taking in the early stages of the epidemic. At the same time, we see we can change the measure where we are reporting, the focus on new deaths only. And this shows how quickly we are getting back to lower level of deaths, reversing the process that got us back, that got us where we are now. As we see here in the path of Italy, that moved to very few cases at the beginning, like everybody else, to the number of peak deaths roughly 1 month later. And then it started a really, really slow phase in which the number of deaths decreased. But of course, we couldn't see this trend in a simple chart. In a simple chart, that counted cases cumulatively. Another useful measure that we can use again is the number of people hospitalized and admitted into intensive care units. This might be particularly useful in the second phase of the epidemic, and epidemiologists I talked to suggested to keep track of the rate of hospitalization too, once the initial outbreak slowed down. This way, we know we're not hitting the peak of our measure, as I mentioned before, since we hopefully see only see it going down at some point, like this is the case for some state in the US. Another thing to keep in mind is that reporting deaths is probably the most important and accurate thing we can do in some cases, but it has also another problem. It tends to be not very up to date. This is because studies have shown that the illness COVID-19 can take up to a week from ICU admission to death, and up to 3 weeks from its onset to death. And this is data that we can see here. These are charts taken from a scientific study on Chinese patients. So we both see here that both for survivors and non-survivors, this illness tend to take a pretty long time, and in some cases almost up to 2 weeks and maybe even a month in the worst case scenarios. So what we can take away from this is that what we are really reporting when talking about deaths is basically what happened 1 to 3 weeks ago, and that's not necessarily up-to-date information to describe what's happening right now. This is another reason why reporting hospitalization can be important, because in a sense they are 1 week ahead when we talk about deaths. When representing our data, our information in visual forms and in charts, interactives, and whatever, there are a number of how should I put it? A number of techniques that are now commonly used, and that might not be obvious. So let's take this chart and take it apart in its components. So let's start by the y-axis. Why its authors are using an exponential axis? They are doing this because in an epidemic, unlike most other scenarios, what's important are not the absolute numbers. It's the path and the direction the epidemic is taken, because it tends to grow and hopefully decrease at an exponential rate. This means that to show the direction the epidemic is taking, in most cases, it's useful to have an exponential axis, which is not something we usually do in data visualization, but this is one of the rare cases where it shows the picture more clearly than a normal axis, where we would have basically an empty chart and only a small part of the space used for our data. The second thing I wanted to mention here is about the x-axis. As you may know, the Financial Times and many other news outlets, and I did it myself too, are not using normal dates. They are starting this axis from the number of days since the 10th death. Now, they use 10 deaths, but that's an arbitrary number. We have to make choices based on what shows the data best. But they did it this way because it allows us to put the curves number of the countries basically one on top of each other. And this makes comparison pretty easy. Just at a glance, we can see how Italy did. We can see that UK started with a higher and maybe in a worse situation than Italy, but it tapered off rather quickly. We see the situation in the United States, and basically since all countries are on top of each other, you can compare them easily, which would not be the case if you use the raw number, the raw dates, since all epidemics and outbreaks happened in different times in different countries. Let's go back to the other point. So one thing that you might see often mentioned is this. Shouldn't we normalize to population using per capita deaths? So this is a little bit of a complicated question. The reason we might want to do this, and we sometimes do this, is because, of course, countries have very different population. For example, in Italy, there live roughly 60 million people, and in US there are many more. So one might ask, why are we comparing the absolute number of deaths? One reason the Financial Times and other news outlets decided to do this, and I think it is correct in the early phases of an epidemic, is that it's not obvious that more populated countries will have more cases. This happens because of mainly two reasons. One is that even at this phase, the number of cases is still low. So we are talking cases and deaths, of course. We are talking about at most 50,000 deaths so far, which is a pretty small number for all major countries. At the same time, it's not obvious that more populous, bigger countries will have a larger epidemic. And as, again, the Financial Times showed, population has a little impact on countries' death tolls. And the relationship between the number of deaths and the population of a country, at least in this phase, tend to be small. So there we go. I started from all of this because before we start charting our data, it's very important to understand what the data means, and for each of the story we want to tell, we have to choose the right data, and we have to put that in context. And for each phase we are in, there might be a different measure. Once we settled for our measure, we can finally try to put that in a chart and go to our data visualization phase. But of course, we have to be perfectly sure that what we are using is the right measure. So that said, which tools can you use? What are the best tools we can use to visualize our data? We have a very little time here, and doing this probably would take maybe days. So I'm afraid I can't go in very detail about each one of those tools. But hopefully this gives you an idea what is available, and maybe gets you a little curious, gets you to try each one and see what works best for you. So what I learned working in data visualization is that there's not one tool that works for everybody. Each one of us has different needs, works in different contexts. Our newsroom may be big, may be small. We might be a freelancer like myself. And this matters a lot, what we can do and in the tool we use and we choose. That's because there's always a trade-off between speed and flexibility in most tools. So as I show you in this chart, these are some of the most important and most known tools. There are many others, of course, but to give you an idea of where can you start. This is true also for this trade-off is true also for the tools I've chosen to show you here. So for example, let's start from the simple one and then get to the more complex ones. You might have heard of Infogram, which is probably the most simple one you can get. You just go on the site, put in the numbers in the simple spreadsheet that it's there, and other few adjustments, graphical adjustments, and you get a simple, but maybe a nice chart like this one. One thing I needed to mention before is that having complicated tools doesn't always mean that they are better. Every tool might be good for its own purpose. So one might be tempted to think, oh, I use complicated tools because they allows me more flexibility and so on, and that might be true. But for example, it might happen the case where one has to put up a story on a chart in half an hour. It happens. It's not of our control. And you don't always have the time to use more complicated tools. So depending on what your needs be, Infogram might be a useful tool for a very simple chart for something you need to do pretty quickly. And this is a tool that is, as I mentioned, super easy to use. It's free. But on the other hand, it can be customized that maybe one would like to, and doesn't really work with very large amounts of data, which might be a big problem in some situation. But if you are looking for a very nice, simple tool and super quick, this might be worth a shot. The second example is about Excel, or OpenOffice, Calc, and other spreadsheets, similar spreadsheets. So as we know, you can make charts out of these tools. The nice thing about this kind of spreadsheets is that you, in most of the cases, you don't even need to download them or install them on your computer, as you probably have one with them already. And another nice thing is that most users are already somewhat familiar with these kind of tools. So the learning curve might be better and faster. At the same time, I have to say, charts you can make with Excel are terrible. Terrible in the sense they tend to be very ugly. So there's that if you care about this. But, a nice chart, a beautiful chart is better than an ugly chart, all things equal. So why not make a beautiful chart if you can? And another thing is that complex visualization, which you might want to do, are possible in software like Excel, but they are very, very labor intensive and tend to be pretty complicated to do. Another very nice, simple and quick tool is Data Wrapper, which is a startup based in Germany by a journalist that worked at the New York Times. And this is probably one of the best tools to use if you want to start from scratch. If you basically have no experience in data visualization in data journalism, and you know, you want to learn, but you don't want something overly complicated, probably this is my best recommendation. This is a tool that it's easy to learn, but can produce very nice charts. And it is frequently updated with new data on the back of it that you can use, such as pre-made maps and so on. And this is also nice, and also with new and different kind of charts. At the same time, data wrapper, maybe if you once really found something that could be better, could use maybe a little more custom size. All charts tend to look a little bit the same, so there's that. If you want to, you know, change a lot in your chart, like using a different font or different styles, different colors, and whatever, this might be a little limitation. Also, data wrapper requires a paid plan access to use all of its features. You can make, I'd say, most of the charts for free, but there are some functions that you can access without a paid plan. Another very interesting tool is Raw, which was developed by information designers, actually, not by journalists or such. This is a pretty interesting tool for maybe a small subset of cases of uses, but for those with a tool like this, you can make pretty non-standard charts like this one. This is called a Sankei chart. And the nice thing about this is that Raw allows you to do this kind of chart, but there are not that many tools that has this kind of chart in them. So if you like this, you can use Raw, which has also a pretty nice interface that's super easy. You just have to copy and paste your data into their interface, and it's very simple to use. So I definitely recommend it to try it out to see which charts it has. It has also a very nice number of non-standard charts that you can use. Now I want to stress, just because there are that doesn't mean you have to use them. I know this looks very pretty, and but I mean, a chart had to be useful to the reader. You don't make a chart because you want to show off how good you are making charts. That doesn't make any sense. I know, because I did it. It's a common mistake that you make a chart because you're a journalist and want to tell your readers something useful. You make a chart to show off. So please don't do that. And another maybe limit of this tool is that it's not. It was not made with the purpose of, you know, you put data in there, export the chart, and put them on your website, in your story, and so on. This was made by information designer as a gateway tool, in some sense, to take data, export it in a way that you can then rework in another vectorial graphic software such as Adobe Illustrator. And the output of this tool might not always be ready for editorial purposes directly, so you might have to work a little more on it later, I'd say. So there's that. When we get to tools that are a little bit more complicated, but also more powerful, probably, there's Tableau Public, and I didn't mention it here, but there's also another tool called Flourish, which in a way is similar to Tableau Public. So the good thing about Tableau Public is that it works with very, very large amounts of data. Large in the context of journalism, of course, not large in the context of big data. But for, I'd say, 99% of what a journalist needs to do, this works just fine. But this is not always the case with some of the other tools that I mentioned. For example, if you need to import a spreadsheet, I don't know, maybe a few hundreds or thousands of rows. You can do this with Tableau Public, but you can hardly do this with most of the other tools I mentioned before. Another very important feature of Tableau Public is that it can cross-reference among different data sets. So let's say, I don't know, you have you want to calculate prevalence of disease in a population. What you can do is take the number of people infected by a disease, and by another source, take the number of people or the population of that country. And Tableau by itself can cross-check, cross-reference these two data sets and calculate that for you. It's actually pretty easy once you get the gist of it. Another important feature that you might find useful sometime is that Tableau can export vector files to be refined with other tools. So you can take the product of Tableau and export it as a PDF file, and then take these PDF files and work on it in tools like Adobe Illustrator, for example, and modify it as you like. And this is very nice, maybe more for print than for online, but still it's a very important feature that you don't always get in this kind of tools. One of the main limitations in Tableau Public is that the free-to-use version make data always public, as the name says, of course. To keep your data private, you have to get the commercial version, which unfortunately is pretty expensive. So this is a decision up to your newsroom, I'm guessing, if it's an investment worth doing. But it depends on the cases. If you're working already, maybe that's what happens most of the time. If you're already working on public data, there's no problem in having it available for the reader, and it might be even a plus. But of course, if you're working with sensitive data, with data if for any reason you don't want to share with the readers, with anybody, this might be an important limitation to keep in mind. Then there's Adobe Illustrator, which is not really, in a sense, a tool to make charts. It's funny because Adobe Illustrator, in fact, was not really made up to create charts, and it takes a lot of time to do works like this one I'm showing. But at the same time, what you're doing in Illustrator is basically working with vector graphics, with shapes, with lines, with arrows, and so on. So working with a tool like this, you are only limited to what your or fantasy can come up with. So it's an extremely flexible tool, and it can produce any kind of chart you would not make otherwise. But you should remember that none of these, for example, none of these elements you see in this chart was made automatically. They were both created by hand, one by another. And so if you want to make complicated visualization, you can, but it can take a lot of time. And so workflow may be slow, and the working with Illustrator may not be suited for uses. Now, I should also say there are ways to get around that. As I mentioned, for example, for this chart, for doing a chart like this, you don't have to take each one element and drawing it by hand, because it will take months. You can shortcut, for example, by doing some elements in other external tools, importing them into Illustrator, and then refining them, which is, for example, how most of my works are done. The last tool I want to mention, this is not really a tool, but maybe a library in a sense. It's called D3JS. So D3JS is a JavaScript library, and it's probably the most common tool used by the most advanced newsroom. You can see works made with D3JS in the New York Times, in Financial Times, and so on. And this is probably in a way, the secret graal of data visualization. this library can do basically everything you want. With some external libraries, you can also produce external charts, animated charts, and really whatever you can think of. There's an important distinction between these and the other tools I mentioned, that to use the D3JS, you have to know how to code. There's no way around that. The other tools are in a way similar to, I don't know, Word, Excel, or whatever, are just tools that you can use point and click tools in a way. D3JS is not. To work, you have to code what the tools is going to do. And this means that D3JS might have a pretty steep learning curve. And this puts it afar from the other tools I mentioned before, but it is so flexible, it's so powerful that you can master it, you can do amazing things. All the amazing charts you see done on the New York Times are done with D3JS. So keep that in mind, that if you want to devote a little time on these tools, it's gonna be worth it. So I think I talked enough. So thank you to everybody, and I'm going to take questions now. So I'm going to exit out the presentation, and there it is. Stop sharing my screen and look at chat. So there you go. So let's start from the latest question. So I go up from there. So we have like there are 15 minutes. So okay, I'm sure we can answer some questions. So Matthew Kaufman asks, I was going to ask about Flourish. Curious what Davide thinks about it. So Flourish, in a way, is similar to Tableau Public, as I mentioned. And I think it's a very interesting and powerful tool. It's definitely worth taking a look. Maybe the thing it's most famous for are bar chart trays. You've probably been seeing them. And it's interesting because you can do these kind of charts with the Flourish, but not with many other tools. So if you're a fan of them, they are pretty fun and pretty popular with readers. Of course, they have to be used sparingly. Not everybody can be raised bar charted, you know. But it's a really nice tool, so I'd recommend it. Maybe its interface is not the best I've ever seen. It's not super intuitive, but I take a look at it. So Patrick Budre asks, hi Davide, do you have a recommendation on where to get data on countries that don't make it as available as in the US and Europe, such as in Africa, Middle East, and so on? Thanks. So this is a very hard problem, a very hard question to answer. So as far as I know, there is no centralized source for this kind of data. As I mentioned, data is patchy at best, even for developed countries. And this, unfortunately, is even more true for poorer countries. So there probably isn't, at least to the best of my knowledge, there probably isn't one single place where you can find data for these countries. One place you might want to look, and they're doing an amazing job there at gathering data, is a site called Our World in Data by an economist called Max Roser. Maybe you can type the address in chat here. There you go. Should be this. There you go. This is an amazing site. They are doing amazing research and data gathering. So you might find there what you're looking for. So let me look at another question. So, Berma Talent, hope I'm not butchering your name. What should we pay attention to when comparing data from different countries? What sources could you recommend? So, when comparing data from different countries, you should firstly try to think which data you're talking about. So, for example, if you're talking about the number of cases, you have to remember that it's not actually the number of cases, it's the number of confirmed cases, number of people that have been tested. So, for example, if you're reporting data from two different countries, you have to, if you want to report cases, you have to check how many tests they are doing in those countries. And if they differ widely, you need to be careful, because when a country is doing many more tests than another, of course, it will look like they have more cases. In a way, it will look like the situation is worse, but it's not necessarily so, because it's possible that the other country is not doing tests, and there are a huge number of people that are infected, and nobody knows about it. So this is very important to think about and to remember when reporting this kind of data. As for sources, I'd say if you want to, it depends on which country you're working on. So if you want to start from scratch, for example, the European CDC has a very nice website from which you can download the data that is already ready to use. So you can start from there when talking about Europe. If you want to compare different countries, maybe I'd go again to Our World in Data that aggregates information from a number of different countries. For the US, I'm not sure. Maybe I do remember that the New York Times made available a spreadsheet, very nice, they made a great job for this, made available a spreadsheet with all known cases. I don't know if they're still doing this because, I mean, there are so many cases right now, I can't even imagine how can you keep track of them. But that might be a reason, a place where to start. So, that's good. So Bermet again asks, the country I work in doesn't publish the number of people tested, only the number of samples tested, the number of confirmed cases, deaths, and recoveries. How can make the most of it? So this is a common thing, actually. For example, even in Italy, where you have the number of people or number of tests, colleagues of mine discovered that the number of tests that you see published for Italy don't equal to the number of people tested, because somebody can be tested twice, for example. And what happens often is that when somebody is about to get out of a hospital, gets tested twice to make sure that he's not infected anymore. So for example, when you take a look at the number of cases, tests in Italy, that doesn't equal to the number of tested people. And that's the same in other countries as well. So when you don't have available the number of people tested, it becomes very hard to report about the number of cases themselves. So perhaps what you can do is focus on the number of deaths, which tend to be less undercounted. Now, as I mentioned, they will be overcounted. There's no doubt about that. But maybe what's important there is not the absolute number of deaths, but the path they are taking. So it doesn't matter, of course, in a way, it always matters, but for reporting purposes, it doesn't matter what the absolute number of deaths is. It matters whether it's going up or down. So even if the deaths are undercounted, you can always infer what the direction of the epidemic is. Now, I should also say that this assumes that the undercounting is equal in time, and this is not true at all. undercounting tend to be there tend to be more undercounting when the epidemic is at its peak. So you should keep in mind that where hospitals and healthcare systems are overwhelmed, it becomes harder even to count the number of deaths. But as the epidemic fades away, these effects tend to disappear. So the number of deaths tend to be similar to the actual one, to the true one. So let's see, other questions that I missed. So somebody was asking, are the countries around the world using the same diagnostic method that is RT-PCR? So this is a very detailed question that I'm afraid I can't answer, because it's likely that each country has its own testing methods, but you should probably, to be sure, ask this question to a researcher. So if you think that the data you are reporting might not be compatible, might not be compared to the one of other countries, should try to find someone who is knowledgeable about this. But this, of course, is another thing to keep in mind, that it's not always obvious that people, the states, the countries are testing with the same methods. So in a way, if that were the case, results would also differ from country to country. Okay, there are a few other questions, but I think these are the ones I can answer to the to the best of my knowledge. So let me see if I missed anything. How do I choose? Oh, there you go. There's another one. How do I choose a sample from different places at a single time? For instance, is it right to choose hotspots in a single country? What would be an accurate set of data? So this is a very important point. I think that we have to keep in mind is that, especially in a time like this, there's no national outbreak. There is no such thing as one epidemic in Italy, one epidemic in the United States. This kind of outbreaks are always local. That's the reason why it doesn't always make sense to work with per capita numbers, because the numbers we start usually are very small. You start everything starts with 1, 2, 3 people that are infected, and they infect everybody else. So all outbreaks in a way are local, especially in a time like this where borders are closed. You can get to one place to another. So when you are reporting about a country, about the country's data, you have to remember that what you see is an aggregate number that is made up of a smaller number of outbreaks in the country. This, for example, is true in Italy, and it's true, of course, in the United States as well. For example, in Italy, we had a huge outbreak in Lombardy, and that's the region that accounts for most of the number of cases and deaths. When it started tapering off, like 2 weeks ago, roughly, we started seeing a decline in the number of cases and deaths. But that's not what happened in all other regions in Italy. So to be the most accurate you have to keep in mind that different outbreaks can have different paths. So it's best to look at each individually. And for example, if you go to the page that New York Times has about this, they are doing this beautifully, and they are showing each state separately. Because otherwise you might be confused by a national number that's not representative of different outbreaks that are going on at a certain moment. And you might mistake a decline in certain states with a general decline. It might not be happening. It's not obvious that a decline in one state means each other is declining as well. We see this in the United States as well, where the number of deaths in the New York State, for example, is not growing as it did as of maybe 1 2 weeks ago. But at the same time, there are a number of states in which number of case index is still growing at a fast pace. So the better thing you can do, the best thing you can do is look at the area you want to report individually, not look at aggregate numbers. Okay, Stella is nicely reminding me that I had to remind people how can contact me when this webinar ends. So the way you can do that is there you go. The way you can do that is probably by email is the fastest one. So I'll link my presentation here in the chat. It's publicly available, so you can reread it if you want to. And there you can find all my contacts, my email, my social profiles, and anywhere you can find me for questions and comments and whatever you want. I'm always happy and available to answer. So I'll be there. So I think this is it. So I want to thank again the ICFJ for having me. And well, thank you everybody for joining us, and bye.